Anxiety is an interesting topic because if you kind of think about anxiety, there are a number of causes, for anxiety. Sometimes people can get anxious, and the anxiety is just based on some thought. For example, a common thing that occurs in my practice is someone's going to have a medical procedure. They haven't had that procedure yet, but they're worried about either the procedure itself or the outcome of the procedure, or things that are somewhat out of their control and knowledge base. But I think the key to all of this is what level of anxiety do you have and what length of time do you have anxiety over? So when I say, level of anxiety, I mean, some people can be, have a fleeting thought, I hope that doesn't happen, whatever, if it happens, we'll deal with it. That's probably a healthy way to address anxiety. The other thing is what we've been talking about, for a bunch of sessions in the past, is just having this kind of chronic underlying anxiety, and that's where you have this chronic level of elevated cortisol levels, elevated adrenaline and epinephrine, by the way, are the same things. So epinephrine, norepinephrine, those are different precursors in your blood that do some of these physiologic things, like elevate your heart rate and affect your pupils and affect your blood pressure and affect your ability for, quote, flight and fight. And what we're trying to go after with the Rebalance system is for people who have that more chronic level or baseline level of anxiety, we want that to be, toned down, because it's the cortisol that is secreted in relationship to an anxiety response, and that long-term elevated level of cortisol is really what's affecting other hormones, affecting people's sleep, affecting people putting on weight, affecting people, even people's interpersonal interaction. Anxiety, sometimes it gets renamed if it gets to an accelerated state. So for example, you've heard of people probably having panic attacks. Panic attacks are just sort of a short-term anxiety state where it gets really heightened, and some people can literally not even function. Think about someone who has panic attacks around taking an exam in college or something like that. Sometimes these people are sweating profusely, and they can't, despite the fact that they know the information to put on the exam, they can't sort of pull it together to spit that information out. A step down from an ultimate panic attack is sort of an anxiety disorder. And anxiety disorders are people that sort of continuously have this high level of anxiety, and sometimes it peaks a little bit and sometimes it lessens a little bit, but it never really goes away. They always have this sort of undertone, if you will, of high anxiety levels, and they're always worried about something or sometimes everything. In today's world, the Rebalance system is potentially a great tool to help with those people with this chronic level of anxiety, to just lower the bar a little bit in terms of the cortisol response. You can tie anxiety to poor sleep, and poor sleep, again, through the cortisol mechanism and through other of these hormone mediators. Poor sleep can be directly tied into increased risk of heart disease, increased risk of dementia, increased risk of stroke, increased risk of weight gain, and a number of other factors. You can tie anxiety directly into heart disease, where there's studies all over the place that show, people with a similar cardiovascular profile, the patient that has higher levels of anxiety tend to have more events, more heart attacks, strokes, and those sorts of things. You can tie anxiety to performance. One of my friends here in town was, or still is, but he was a professional fighter in the UFC, and he was in one of these UFC, the house program where they all fight against each other, and whoever comes out on top gets a contract and whatever. So he won that, but then when he got into the ring and around all these people, he couldn't perform. He was, like terrible, frankly. Yet when he was in a smaller venue, or he wasn't fighting on TV in front of all these crowds, so we actually got, people that specialize in that, sports psychologists, to try and work with him to decrease his anxiety level so that he can actually function. Medical residents and medical students, in the trauma bay, all this stuff's going on. You have to think very clearly and very rapidly, and you have to have algorithms in your head, and you have to know what you're doing. Anxiety gets in the way of that. You cannot think and function and do the right thing when you're totally anxiety-ridden and panicked, literally. It's multifactorial in terms of what the outcomes of anxiety are, but all of them are bad. They're either not functioning well, or they're increasing disease risk, or they're making sleep bad. And I think that utilizing a number of techniques to quell anxiety, like the Rebalance system in combination with other psychological techniques, is probably the best way, to approach it. The studies do show that it works a lot better if you have, like, for example, if I'm in anxiety, I happen to not have personally a lot of anxiety, but some of the reason is I prevent it, like, exercise prevents it. Meditation prevents it. Not that I don't know how to meditate, but it's a good technique if you can. Exercise prevents it. Healthy lifestyle prevents it. You have to approach it from all different ways, and then it will absolutely lead to better performance in your daily life, your job, whatever, and healthier outcomes long term. So the first thing is the result of being in an anxious state, or certainly a chronically anxious state, is elevated levels of cortisol. You can substitute the word stress for anxiety in a lot of these sort of situations, okay? And cortisol is your stress hormone, right? And as we've talked about before, there are certain times when that's a healthy thing. You probably want to get someone alarmed and anxious if you see a mountain lion on a trail. You probably don't want to be alarmed and anxious when you pack your suitcase, So I think there's appropriate levels of anxiety and appropriate length of time of anxiety, So we, first of all, are addressing the results of anxiety, which are the cortisol levels. Okay. The second thing is that there's direct tie-in between anxiety and insomnia. So when people don't sleep well, as we've talked about in the past, there are certain hormones that are selectively secreted during certain cycles of sleep and at night, et cetera, et cetera. But when people don't sleep well, that heightens their level of anxiety the next day, and that's been kind of shown. And it's a vicious cycle, because a lot of times when they're not sleeping well, they're thinking about what's going on, and they're anxious, and they're laying there. So everyone's been through this, right? You're thinking it's 3 in the morning, you woke up, and you can't get back to sleep because you're just ruminating about whatever's going on in your life. I think we help people with better levels of sleep. I think we help people with cortisol, which is one of the end result hormones of an anxious state. And I think the other recommendations, like the psychological recommendations, the recommendations for exercise, for example, well, hopefully we're also helping people with exercise, right? Because we're improving hormones that, by decreasing cortisol, we're improving hormones like testosterone and things that would help with exercise, help with exercise outcomes, help with how you feel during exercise, your recovery after exercise. The system itself kind of helps in many ways, but I also would say that to really be complete, you probably have to control the initial. The system isn't really fixing the reason you're anxious, right? It's fixing the result from being anxious. I think that's a way that I kind of look at it. So you have to address the reasons you're anxious. Exercise helps with that, so that does tie in a little bit, but meditation, again, using some very specific psychological techniques like desensitization, where we walk you to the airport and we send you home, and we walk you up to the runway and we send you home, and we walk you, and all of that kind of stuff. There's a lot of techniques like that can be employed, but I think we're addressing the outcomes of anxiety. We're helping with sleep, which decreases the level of anxiety throughout the day, and we're helping with one of the better techniques to mitigate anxiety, which is exercise. You get more benefit as you go, let's say over a couple of weeks, over a couple more weeks, up to maybe 90 days, you start to maximize, you're dealing with the anxiety or the outcomes of anxiety. To me, it's almost like the sooner you start, the better. Like, you have to start somewhere, and taking a quick fix like anti-anxiety meds, anxiolytics, as you mentioned, those aren't good answers, because those are really just masking symptoms. As soon as you stop those, the symptoms will come back. We need to, when people have real anxiety issues, it needs to be dealt with in a multitude of ways. And yeah, a quick fix, like, it's totally true. If someone is super claustrophobic, let's say, right? And let's say they need to get an MRI of their head, and they got to go in this little tube, and they're super claustrophobic. It's very common for me to give them a Valium before, a one-time event like that. Or they're about to, have a surgery or procedure. Most surgeons will give them, a Valium the night before, or an Ativan, or one of those meds. But that's for a very specific situation, not for what we're trying to deal with, which is kind of this long-term level of elevated cortisol levels. It would be great if long-term the patients were getting off of those other anxiolytics or anti-anxiety medicines. So there are a few different categories of anti-anxiety medicine. So one of the categories is what you mentioned. They're the benzodiazepines, and they're basically like Valium, Ativan, Xanax. And those are really not drugs people want to be on for long term. They increase the risk of dementia. They increase the risk of falls in the elderly. They are just generally not good drugs. And the next level are these combination sort of antidepressant, anti-anxiety drugs, things that a lot of people are on, for different reasons. In my opinion, way too many people are on these things, because if you look at the studies, they're not that great long term. So things like, Lexapro, Wellbutrin, and all these other things, yeah, they help short term, and then people kind of get used to it, and you have to go up on the dose. And some of those things do quell anxiety. But to me, that's something that if someone, again, is just like, you come to me, you're a college student, you have a bunch of exams going on, you can't deal with life, I may consider starting you on something like that short term, but for sure we're working on the other ways to quell anxiety, right? I mean, it's just not going to work long term, and the studies prove that. Another class of medications are used for both sort of tremor and anxiety, and there's certain actually heart drugs called beta blockers, like propranolol and different drugs people might have heard of. Those drugs work okay for anxiety, but unfortunately they do not work well because of the side effect profile. People get too low heart rate, they can't exercise, they get all sorts of sexual side effects that they don't want, they get all sorts of blood pressure drops and other things. So really there's no great medicine for anxiety, but there's no question that as a clinician I will use certain medicines if the situation is significant enough on a short-term basis while we're starting all the stuff. So that's maybe another answer to your prior question, which is, sometimes it's so bad we have to do some more aggressive things initially, but then the idea is get the people off these meds and get them to deal with anxiety in a more sort of healthy way. Of course, they all help with anxiety, usually just short term. But having said that, the side effect profile, usually when people are on them for more than a short period of time, starts to outweigh the benefit. And they get tolerant of the meds, and frequently you have to go up on the meds, or they have to use them more frequently. And then you're right, it totally can dull clarity of thought for sure. The benzodiazepines, Ativan and those things. They also have that particular class of drugs has huge addiction potential. They're probably the most addictive. Everyone talks about the opiates like heroin and all those things. Benzodiazepines are by far more addicting and more dangerous to come off of if you're having an addiction issue. So I think all around, what we're trying to do is help with some of the outcomes of anxiety, which is mainly the cortisol levels, help with the sleep component, which decreases anxiety also, help with the exercise component, which addresses anxiety long term. And that's a very safe and healthy way to deal with anxiety, as opposed to kind of this short-term quick fixes. I think quick fixes generally don't work very well, especially in a longer term situation. If it's one of the tools in the toolbox long term, which you should potentially be on, forever maybe, I think that's okay to say in a sense, because it's just like I wouldn't tell you to stop exercising. I wouldn't tell you to stop meditating. I wouldn't tell you to stop, eating correctly. I wouldn't tell you to, to start drinking a bottle of bourbon a day. I wouldn't tell you, that kind of stuff, right? To me, it's multifactorial, so it is another tool in the toolbox to help decrease the effects of any anxiety that they do have. Remembering that it's not a perfect world. So even the best, I consider, just because of all my time in the trauma bay and all these things, right? I definitely have a way of controlling anxiety. Like it's not when I'm doing something very specific, I don't. So that's something that I trained to do. I mean, I used to not be like that for sure. I used to be crazy, hectic in my head. And once you get to that level, it doesn't mean that I don't have spikes of anxiety. So I think even long term, if you're great at controlling your overall anxiety, this will help for any little blips or spikes that you do have. Or if a situation comes up, like, your spouse is ill or something goes up, you're definitely going to have, or you get ill or something. Now you have a new type of anxiety to deal with, and you have to learn to quell that. And this would help while you're doing that. Short term, let's call short term like a week or something. My guess is up to that point, there's probably not a lot of difference. I had success recently. So I had a patient, and this is not the only type of medicine or supplement that this happens, but so I had a patient, and I talked to her a few weeks ago, and she's like, Dreamcatcher product, it's been fabulous for me. I've never slept so well. I feel much better, blah, blah, blah. But the reason we were having the conversation, she said, it's sort of stopping working. It hasn't been helping me as much. So she was developing some tolerance to it. So I actually put her on a drug holiday, so to speak, for about, I think 3 or 4 weeks or something like that. And that's sort of my method for a lot of these medicines that kind of people get tolerant to. Sometimes when you take people off or when they take a break, they actually see the benefit when they restart. To me, they're degrees of the same thing almost, where sort of stress is the sort of lower level and anxiety is a bigger response, like really high stress you might call anxiety. But honestly, they're they're a little bit synonymous in certain respects, and maybe it's just degrees. Maybe you have kind of stress, and then maybe you have kind of anxiety, and then maybe you go up to like panic attacks, and but they're all really kind of similar. They're definitely kind of, to me, on a continuum of sort of a continuum of the degree to which you're having this sort of disruption. Any level of stress, chronic stress, any level of chronic anxiety, any level of intermittent panic attacks, or people with true anxiety disorders, which that's the sort of thing that it's a clinical diagnosis where it's enough anxiety that it's affecting their daily lives. It's you can't perform your job because, I don't know, you're afraid to touch the keys on the keyboard because you'll get electrocuted or something crazy, whatever. But that is a true anxiety disorder. So it's really degrees to me. It's really the degree to which you're feeling the same sort of symptoms, and you definitely get the same physiologic response, whether you call it a stress response, an acute stress response, a chronic stress response, or whether you call it anxiety or acute anxiety or chronic anxiety. The same thing's happening. It's disrupting sleep. It's leading to other diseases like cardiovascular disease, other things. It's disrupting it's disrupting your hormone balance. In today's world, the Rebalance system is potentially a great tool to help with those people with this chronic level of anxiety, to just lower the bar a little bit in terms of the cortisol response.